Okay. So a little bit about our seminar series. The Global Health Leadership Series is hosted by Dr. Ramanujam and the Center for Global Women's Health Technologies, bringing leading innovators who have impacted global health through disruptive technologies, novel educational models, and social entrepreneurship. And today we are excited to have Dr. Manu Prakash as our speaker today. So without further ado, Dr. Ramanujam, our director of the Global Women's Health Technologies Center, will introduce our speaker.
Hi, Manu, nice to have you here. I just wanted to tell you a little bit about Dr. Prakash before we get started. He is an associate professor at Stanford University, and his work essentially embodies the idea of frugal science to democratize technologies for health. For example, the detection of infectious diseases. And also really exciting is he's using his technologies to democratize access to innovations that a global community can use. So he has this global citizen science program to facilitate that. And Manu, I have to say, I just heard that my lab bought 40 foldscopes, so we're big fans of yours. Manu has received a number of awards, including the MacArthur Fellowship, and he's also a senior TED Fellow, and he has a plethora of innovations, which we'll hear about today. So with that, I'd like to just, his title aptly is How to Build Global Communities Around Ideas. So we're very excited to hear your talk. Over to you.
Thank you, everyone. Thanks for having me. I apologize, I just joined in last minute. I'm assuming you can all see me, and let's just try to confirm that you can see some slides on my end. So I was hoping to keep this hour very informal. To interrupt, I think if this becomes much more of a conversation, that's far more fruitful for me, and then maybe also might be fruitful for the listeners itself. My name is Manu. I grew up in India. I think I've been running my lab for almost a decade now. So this is almost a little bit of a reflection as well in thinking about not just sharing the technical aspects of the science, but ensure as global health researchers, as technologists, as people, activists, as people who deeply care about change to happen on this planet, just what has failed, what has worked, how do we move forward from where we are? And I think that's why I decided I will sprinkle in and talk about the technical aspects, but it's valuable to just also reflect upon for every type of a solution, thinking of a very clear way of engaging the people that you are truly trying to inspire and empower comes in many forms. So I think you will see this is a little bit of a metaphysical talk as well, and I apologize for that. So first of all, I don't work alone. I have an incredible group of people here spread around the world. I can't even talk about the thousands and thousands of people that belong to communities that we have been trying to empower and build. So much of that is to say that I represent their voice, represent them in the projects, but this is much bigger effort, and it has to be if we are really trying to scale. And I think a philosophical question that I want you all to start thinking about is a question of representation, and something that has bothered me all my life as a scientist, which is who really defines the role of science in our society, who is science for, and who will have access to science, who is a consumer of science, who is a creator, where does the power lie? And just it's embodied in this photograph that for me is very meaningful, but I might have to give a little more context. This is a picture from a rural village in India. These kids are holding an object in hand, which we created almost a decade ago. And, there is this sense of excitement that I can see in this photograph around science. Just there is, I can hear the chaos in this picture. I don't know if you can hear pictures, but I can hear this picture. But on the other hand, it also has taken 10 years and there are 2 billion kids on this planet and we are losing time. And unless we can truly bring a society that, from the grounds up has access to science, not just the communication and the benefits of science, but then they can play a role in science, we find it very difficult even to have the best sets of technologies that we can have at hand to truly be either made accessible, enough number of people working hard to make sure everybody's counted, and at that same time able to shape these technologies for them to be meaningful for majority of the stratas of the society. So, it's a tall order. It's something that you can all think about in your careers, I'm sure, as many of you delve into what you want to create. It is a difficult challenge. And, we have to do this with the kind of excitement that these kids are showing in this photograph. The other thing to think a little bit about is, I'm not going to spend too much time on this, but much of my work has been shaped by just experiences. We work in Ghana, and I remember taking this photograph where, a bus stop becomes a hospital. This is a weekly hospital. Many of these kids possibly have malaria, and once a while a van comes in, and the van is really all the infrastructure that there is. And often enough, this ends up being the grassroots healthcare for a very large majority of people on our planet. And, this is preaching to the choir in terms of what truly global health means and how do you really bleed health capabilities into people's livelihoods and their society, and how they live becomes a really challenging aspect when you think about the sets of technologies that work and don't work. So, these types of pictures are difficult to fathom and think about in terms of how do you cause systemic change. But at the other hand, also set the boundary condition for what are you trying to invent and innovate around. And finally, I think I have to make a comment around much of this, and in the perspective of COVID. Often enough, as technologists and people in the health community, we are incredibly excited about this whole Sputnik moment of our era and an incredible number of technologies that have come about. And on the other hand, this is no news to anybody that works in global health, but is also a moment of awakening for majority of the people in society who just don't think about this, that the equity of access is really what we have failed completely at in some sense. And here we are. And this pandemic is a phenomenal example. It's not the only example, but it reminds us that in the era when we about solutions, unless we thoughtfully, which should be from day one, think what is the final goal. If the goal really is to come out of the pandemic, that requires access of most of these technologies to every community, because otherwise nobody is safe in this perspective. And we have dramatically failed on that. And I think this is something, not that we did not know that this challenge would exist, but just the way that we have structured this idea of bringing health technologies to all just does not, that structure does not reflect the kind of a problem that we are trying to face. So, I think these are bittersweet moments in many ways to think about, and how do we take this challenge and combine with the challenge that it's not just the pandemic and COVID, it's, you can look at the data for TB, you can look at any of the education data that has come out, and the remarkable hit COVID has had. Almost 500 million kids have not been able to access any education for that matter. You can look at this in the context of climate. Think about just the species loss that has been documented for almost the last decade now. and the inaction that's associated with that. And it starts to paint a very grim picture that COVID and inequality of access to technologies and solutions for communities to even do their job is not just a COVID phenomena. It is a phenomena that's ingrained in how we think about what solutions are. And aptly put, if we didn't handle this pandemic in a global solidarity kind of a context, what are we going to do when it comes to the kinds of climate challenges? And of course, the overlap of climate and health, which everybody knows is be a frontier of global health in years to come. So here is sort of a grand vision / challenge for all of you, which is these 3 pillars of environmental context, educational context, and health, to me are one and the same thing. Each one of them advances and pushes each other. And for us in many projects and communities, whether we like it or not, we get pulled in the other directions because many aspects of, there is a deep amount of interconnectedness in these aspects. So this was my doom and gloom story. This is an early morning for me, so I don't want to be a depressive speaker in some sense. But I do want to paint the broader picture as well. As all of you make advances in the specific areas that you're working on, keep thinking about these broader challenges. And the way that I have found some relief in my what is the purpose of my own work and the kind of work that we want to empower. I've always felt this notion of we really need planetary scale solutions. We need solutions to work across the planet because we as a species are incredibly connected. And we need to create a kind of an inclusive environment where what I will define in my world, a community health worker is a citizen scientist. And we need to define a kind of an inclusive environment. By every definition of the word, they fit the bill, and they form the world's largest citizen science cohort. They're scientists on the front lines, seeing much of what unfolds, and how do we really empower them in many ways? And how do we create this very deep dialogue and a back and forth between the folks that play the professional scientist role versus the other folks that have an incredibly important role to play hat in a conventional sense. So is this the first time that something like this has happened? And the answer is no. And I'll refer it back to Sputnik for a kind of an example that I find empowering. So I don't know how many of you were born when Sputnik was launched. I was not. So this is only stories, but what I'm told is this little a basketball size object. It's supposedly this big. And it has made a remarkable change in people's philosophy. When it was launched by the Russians, of course, it caused a panic across the nations because there was a spy that was flying that you could do nothing about. But there was a remarkable astronomer at that time. The reason it caused panic is we had no technologies at place at that time to actually record and track satellites. So any of us could have claimed we have a satellite, and unless you put a radio transmitter, which the Russians did to make a point that there is a satellite up there, anybody could have claimed that. And Fred thought of this remarkable program, which he called Operation Moonwatch, literally putting $10 telescopes in the hands of tens of thousands of people around the world. And this program, the citizens-driven program, competed with every possible technology, with hundreds of millions of dollars being put by the army and much of the defense industry to try to track these satellites. And for the next 30 years, every satellite that was launched by the Russians or any other nation was actually tracked by members of Operation Moonwatch. Anybody could join. They were given a class of scientific tools. At Radio Shack, you can still buy versions of literally this telescope. But they were taught, and of this little quote in the middle here, which says, on the United States, Mrs. Lloyd Eisenhower, housewife volunteer, sought Sputnik 2. And almost all of the launches after Sputnik 1 were detected by Operation Moonwatch team, transmitted the location to the defense and the governments. And then after that, the tracking continued. And what they're doing is quantitative science. They're not just looking out in the sky and hoping that one of them will hit, which acts how amateur astronomy works. They are looking at quadrants in the sky. They are mapping exactly when a satellite comes in and out. And then they are relaying that information to the stations via radio. And the next day, they're given a new quadrant to track. So then for the next 30 years, this was our primary network. And if you go back and look at these data sets, these are some of the finest data sets from that time for any astral bodies that are being tracked. And I take a lot of pleasure in thinking about this example, because when I think of parasites and when I think of infectious diseases and when I think of the role of citizen community health workers, I see a very deep parallel. We are not as organized as Operation Moonwatch was, to say that many community health workers respond to their national needs. And I wish there was much more of an international connection between. But frankly, this picture of a healthcare worker that is probably not more than 20, 25 years old on the backpack is heading in a boat to an Ebola infected region. And all she has with her is this backpack. And she is at the front line of some of the deadliest diseases. And effectively, when you think about what happens when you interface and interact with the community at large, and then the members that are interacting are members of the community itself, there's a remarkable change. And I think often enough, I've thought about how do we really build tools? And as technologists, what do we put in the backpack for this person? What is the class of enablement that we can provide? And how do we really make sure that many more citizens of our country are actually even excited about this profession? Frankly, it's a very difficult line of work. And if we don't empower them, I don't see any way we can sustain the kind of volunteerism, frankly, that exists in this community. Many of these people are not paid, never paid on time. And one of the factors they have is a deep appreciation for what is happening in their community. And we have to ask ourselves this question: are we building technologies keeping them front and center? And so I think that's really the I want to give to all of you is, if you care about much more grassroots deployment, this is really the pinnacle of how to think about these types of questions, at least in my mind. Now, as just on the side of technologies and solutions, there has been a big push on our end to think about democratization in the context of diagnostics and ecosystem and infectious disease surveillance. And I'm going to this talk will primarily be just a reflection on certain of these solutions and what I see the future of these types of ideas, rather than the technical detail of each of the ideas. But I will touch upon them so you get a sense of what types of things we think about. But my personal journey in this began almost 11 years ago. I said I grew up in India. I trained as a physicist. I have been involved in thinking about questions in biological sciences. And then when I started my lab, I asked myself this question is, who is this all for? And I started spending time in communities. And I was challenged by, you can imagine a young assistant professor, enthusiastic, arriving in Uganda, talking to a veteran who's been training and teaching 40 years. And I was given a challenge. A friend of mine very politely, but very clearly told me, come back to me when you can do diagnostics under a tree. And that was literally 10 years ago. And what a perceptible sentence. And I've lived by that sentence. And when I look at COVID, I was like, how did this person predict? I wish I had diagnostics under a tree, because I just dropped my kids to school. I want to know if they have COVID or not today before dropping them to school. We are in one of the biggest waves. And unfortunately, I have to say, the kinds of solutions just have not existed. Technologies have existed, but solutions have not. And there's a big difference between the two. And I think for all of us to remember that is very apt in the context of global health, because price points associated with each one of these things matter. I can buy $100 COVID test right now that can do a PCR level quality test under a tree. But many of my friends in Ecuador make $400 a month. And currently they're paying $75 for a PCR test that comes back in 4 to 5 days. It just does not make any sense in terms of thinking about, do we have any way of stopping this virus and effectively many other infectious diseases? So I think this is people that I don't get to acknowledge that often, but are really at the heart of these conversations, that off comments that lead me into a path that lead to an idea. And I think it's really empowering. For the last 2 years, we have had to stall most of our field work, and it's taken a real toll in terms of being able to, even though we do Zoom and other factors, to really be able to have heart-to-heart conversations around what challenges we are trying to solve. So I'm going to share a few sets of challenges, and I think let me mention a few things about community building in the context of COVID, and then jump to broader sets of ideas. I don't know how many of you know the history of how bicycles were invented, but we would not have had a bicycle that early. I think we would have had a bicycle for sure, but not that early unless we had a massive volcano and a famine. So this is the volcano in Tombo, and one of the factors at that time was a massive Europe famine happened, which killed all the horses. Horses were the primary way people would move, but because there was no food, there were no horses. And that led a gentleman to think about, maybe there is a better way to transport. And then the famine went away, the volcano cloud went away, but the bicycle stayed. And often when I'm thinking about COVID, when I'm thinking about these singular moments that happen in our lives, when we see that, the malaria cases are rising again, I see these crisis modes, or some of you have read the microbial resistant Lancet paper that had just come out last night, massive toll on people and just no solutions in sight. These types of crisis mode are our bicycle moments. So we should embrace them and really think about what transformational changes we want to do. I think for us, COVID became a moment like this because we essentially quadrupled or something our efforts in engaging with community, sharing solutions far more quickly than we will ever would, and trusting the sets of partners to really take them in directions that they felt appropriate. We do open science work. Most of the work that we do is in an open science format, but we used to do that in the perspective of sharing the work when it's complete. And in the context of COVID, we actually started sharing work when we began the work itself. It was a very uncomfortable situation, but ironically, that one single decision that I made in first week of March when I myself was sick changed how we build communities. I put together a Google Doc of the sets of challenges that I was hearing from my partners and folks in the field. And we divided up and listed that as an open Google Docs. There was something like 15 or so Google Docs at that time that we created as a lab. But anybody could join in and comment. And that started, a seed of sets of communities, other people who were thinking about exactly the same problem, other people that had technical expertise that wanted to engage, and other folks that were literally on the trenches, including many clinicians that directly joined from around the world in problem solving and solution making, which, often enough, we don't have the kind of percentage of people. And I'm talking about, for every one of these ideas, groups as large as between 100 to 500 people engaging in a productive manner. And there are certain challenges when larger groups work together, but we built certain classes of paradigms of what we would do. That led to a number of projects that are all publicly accessible all the way from bringing elastomeric masks, respiratory masks, which are reusable, rather than these masks that are disposable and are not accessible in many global communities for the highest level of protection. We engage with companies in Kenya, India, Nepal, and designing a new model for medical devices in the context of a reference design for open source ICU ventilators, very much framed around how browsers are designed. So many of you are using and watching this talk via a browser, but there is a core open source framework and code that all the current browsers actually use. And so in the context of thinking medical devices, there are a huge number of challenges with open source medical devices, because who is responsible? How do you really build safety and risk factors in technologies that are open source? And we've been thinking and tackling, and that question really got framed in this perspective. One of the other factors associated with this was engaging with communities and commercial partners. So, both for puffer, much of our work that we did with these elastomeric respirators, thinking quite a lot about the deployment of technologies in a rapid pace, was all driven in the context of designing with the users. And I think in some sense, many of the users played a critical role in the design cycle itself. And one of the factors that led to is directly working with small scale manufacturers, because primarily in a normal situation, you invent an idea and then you have time to build an entity and then think about deploying it. Here, it's almost to an extent that many sets of people were eager to engage, but we needed to find the kinds of people who would dedicate and steer towards essentially building things in the biomedical space, and especially in countries where this is not so common. Another challenging thing that we found in this is regulatory framework, which is something that we are trying to now document, because many countries don't have their own regulatory bodies. And many of our federal agencies, they depend on FDA approvals and other factors, but many a times FDA does not, they're not to regulate and provide regulatory advice on products that will not be deployed for the American people. And that puts a really challenging task about phenomenal products and ideas, but because we don't have global entities other than FDA and some of the CE marks that have the level of expertise built in, which is incredibly important. And so I think this has led us to think quite a lot about what are the types of structures that should be created for products that are really, which don't exist in the global north, but we still would like to utilize the expertise and build the kind of common frameworks. And I think India has taken quite a lot of lead, but they were not so ready with the level of engagement and innovation that happened for these class of products. I think Kenya, we work with the ministry to try to build these types of frameworks, but you cannot build those things in such a short time. I think it does require a sense of trust. Agenda item that is still open in terms of thinking about. The other factor on communities was really just how do we as scientists engage and provide the kind of information and frankly fight the misinformation war. This was a huge challenge, something that I don't often even think about in my traditional work because we go through a very stereotypical channel, but we found a major challenge. It got culminated around masks because masks became political really early on. So we started this organization with many of our friends and academic friends, but from all circles, all the way from people who had worked at OSHA to people who are occupational health, but physicists and chemists and biologists. And we started this organization called N95 Decon, trying to provide a rational approach to be thinking about decontamination solutions, because the first sets of 6 months, we found a huge lack of masks accessible. And then rather than what we did, because what we did is documented very well on N95Decon's website, I think maybe a word or two to mention, there is literally hundreds of documents and SOPs that we published for hospitals for around the world, especially MIC groups. We developed classes of decontamination technologies that was then shared more broadly. But more importantly, I think a comment that I want to make is, how do you make something like this work as a glue? And ironically, what we built in this round was, I have often called this a headless organization. And you might think a headless organization is like a headless chicken running, and how could you even do something? The answer lies in just empowering individuals that are coming along and giving them a seat at the table. And natural leaders rise in these groups. And again, I'm not sure whether this is truly a phenomena of a crisis, because everybody felt the crisis so deeply. But it was really remarkable to see, and especially many of the young individuals that really took on leadership positions just naturally by the work that we were doing. And still today, I think I have thought quite a lot about looking at organizational structures in when we engage on problems at large scale, and asking ourselves this question: are there better ways of building these structures from the ground up? I think often enough, this is something that you think about, but at a later stage when you have an idea. Here, the organizational structure was far more important, even without knowing what we were going to do. We actually replicated with certain sets of tweaks when the second Delta wave hit, that led to an organization called India COVID SOS. Roughly around 500 academics, individuals, NGOs in India, all focused on primarily a support role for what happened in the Delta wave in India. Operationally, that led everything all the way from thinking about health issues that arose with the number of deaths that many healthcare workers were feeling. Various sets of technical solutions on the context of oxygen shortage, literally deploying oximeters. We discovered early on that many oximeters in the market in India did not work on dark skin. So we had to figure out regulatory frameworks to get that knowledge shared very quickly, run clinical validations on as many of them as possible, because they were not everybody. And then, of course, most importantly, also getting rational information out, because WHO had not stepped in at that time. And I think afterwards, WHO came up with these tips for managing at-home COVID, which were very similar to what we had released. But one of the factors that was associated was, when in a pandemic and a crisis, information will travel. It's very important to put good information out, because otherwise bad information will fill that void if there is a void. And it was a very difficult and an ethically hard decision to make, that when WHO is taking time and these many number of lives are being lost, what is our ethical responsibility and role? And as many clinicians that were in the team that took the leadership on this front, we just had to make this hard decision. It is important to share what best practices have been learned around the world as quickly as possible. But because we had clinicians based in India, and this is hundreds of clinicians, we also published some of that work really early on to build consensus in the clinician community, engaging with the Indian medical associations. But one of the factors there is that it's never so obvious in the act of doing the work. Now, retrospectively, I look at it and the death toll, that it was just so obvious. I wish we had even done that faster than we could possibly do. But in those moments, it's always hard. And you just have to make these hard decisions, but do them with a consensus context. That's all I want to say about COVID. There is so much to talk about. There are so many, I would say, scars that I could talk about in conversations. But let me jump and just share other classes of technologies, because frankly, there are very important disease problems that we still need to be focused on, although COVID has taken the lion's share of our time in the last couple of the last 2 years, and the money, unfortunately. I'm going to briefly mention a class of diagnostic technologies and how we are thinking about developing. But I also just want to give you all a flavor of what frugal science is. I forgot to say that the title is Frugal Science. I never said what frugal science is. Frugal science to me is a way of thinking about a problem and really turning it on its head with science at its core to tackle and solve a problem. So the problem that I got introduced to in 2013 on one of my visits was with another conversation with a healthcare worker is around sample preparation. Diagnostics, every time you're looking for a needle in a haystack, you need to process those samples. Centrifuges are a very common tool that are used. We later realized industry had deployed all these centrifuges in primary health centers, but they had forgotten to deploy electricity, not for a fault of their own, because there is no electricity in many of these regions. And we found ourselves in a place where just we couldn't process anything. And on the flight coming back, I am always excited by toys. And I started making a list of as many number of spinning toys. So that's Dino in my lab, a circus artist. He taught me how to play with yo-yos. It turns out yo-yos are very difficult to work with. But in the state space of solutions, we actually stumbled upon this toy that's called a button on a string. This is a toy that you've all played with as a child. It's kind of a curiosity. But it turns out, if you look at the history of this toy, in the history of mankind, almost 5,000 years ago, relics of this toy exist. The Greeks have used this toys in funerals. The Incas, they've been found in close to Jerusalem. And one of the factors that's associated is nobody asks a question of how does this simple object work? And that's kind of the science portion of this. And we asked that question. It took us 6 months to figure out. And here is how it works. It's just, in a single equation, I can describe every possible detail. But this is the important aspect. I think about frugal science, that you really have to merge empathy with hard sciences. Once we understood this, we were able to make centrifuges. We hold the world record at this point of the fastest spinning object with human power, which is we can spin these objects all the way to 125,000 RPM. That's 125,000 revolution per minute. One of the things this is equivalent to is 30,000 G forces. And from a biological context, what this allows me to do is in 90 seconds separate pure plasma in the middle of nowhere, or actually in less than 3 to 4 minutes now, separate a single blood cell that's infected with a parasite. And effectively, one of the things that it immediately does is enables what many fairly expensive centrifuges can do, but in the middle of nowhere, purely driven with human power. That has led us to very broadly think about what does it mean to have powerful tools and technologies. This is a video from our field site in Madagascar. There's a lot going on in this picture. One thing that's interesting is this is a village chief. We need his approval to even do our clinical work. We are validating this for sensitive malaria detection. But you will notice that the tool is not built like a black box. It's still a children's toy because we want people to understand and appreciate. And one of the factors is there's a lot of language barriers. The chief, when he entered, was very skeptical, but then he's slowly starting to understand. There's something really interesting happening. In this room is filled with men, other than one single woman, which is sitting right behind the chief. She's actually the community health worker. And because of these types of rituals that women are not allowed in these sets of community decisions, because of her position, she's the one, and again, being the only community health worker for this village, she has an incredibly important role. And I think over and over again, we find these types of both gender inequalities, but also key critical people that then we can engage and try empowering. And so, there is a meta story here for how, for us, it was incredibly important thinking about this setting we can only do so much on an immediate as an arrival to change this, but to find her in that room was very important to us. And because this is her advice is what the chief listens to in the context of when health decisions are made, which is quite empowering to think about. We released this as an open source tool, and that led to a flood of ideas around this as a platform. Rather than developing it a single diagnostic and packaging it inside something, that led to really kind of a very broad innovation. There are some really fun diagnostic tools that are out there. Currently, there is a urinary tract infection device that's based on this, but using fidget spinners. There's actually a PCR-based system that's being developed. We developed a COVID test associated with a version of this tool, which is a LAMP-based assay. We've replicated this in many of our field sites. So for some of you might not recognize, this is a version of that tool, but really designed around thinking about safety and thinking about infectious diseases per se. And I think in technology development, sometimes it's important to open up the box before you close the box. And that's been a really fun lesson for us to think about, that once there is a key insight, how a broader group of people, because there are just way too many number of problems that we individually can tackle. And then there is a slow transition into thinking about the sets of applications that do stand the test of time, then can be scaled up. Another thing I want to mention really is around surveillance side of the story. So diagnostics is a challenge. This is both a funny picture and not so funny picture. I don't know how many of you work on mosquitoes. This is literally a postdoc in Australia with a tweezer in his hand. I call this the mosquito bucket challenge. If you estimate, by any estimate, this bucket has somewhere of the order of 10 to 20,000 mosquitoes. And he's given a tweezer and a microscope, and he's asked to identify what species they are. As you all know, mosquitoes play an incredible role in transmission of diseases, but vector service is essential for us to decide what types of interventions we would deploy. And literally, the method that he's using is exactly what Ronald Ross used when he was trying to identify and associate malaria with the malaria-carrying mosquitoes in India. And so ironically, this is 2020, and we still use these sets of technologies, and you can understand why we have such a poor view of the logical side of many of the diseases. We started thinking about this problem almost 5 years ago, and we made a really interesting discovery, which is mosquitoes sing love songs to each other. They literally have to generate. So this little buzz that you've heard in your ear sometimes when you're sleeping is quite literally a mosquito communicating male and female in air, essentially trying to identify species. These acoustic sounds are associated with species, and we asked ourselves, could we utilize 5 billions of these dumb phones that exist, literally flip phones? And so this is exactly what we did, building an acoustic map for majority of mosquito species. And all of this data that we published a couple of years ago was collected by a $5 flip phone, to just demonstrate that, it's not just about smartphones. Any kind of hardware you have, you can build. And we've been building a lot of machine learning framework, training entomologists around the world to start to build a community. And mosquito identification should not be really something that you'd get trained for 10 years as a taxonomist. And ironically, some of my friends tell me that when you look at the map of where different species of mosquitoes are, say, for example, in Africa, India, in the US, and many other, it does not represent truly those species. It represents where entomologists and medical entomologists live, which I found quite heartening to think about, is because only when you have a capability to detect something will you actually be able to pinpoint. And we looked at these maps, and we found for Aedes aegypti, for the entire continent of Africa, there are 500 data points. That's it. I mean, 500 data points. I volunteers across and triple the orders of magnitude in terms of the kind of data that could actually be collected. So that's what we're trying to do, is to engage kids and youth and college students in doing this. This is a workshop, again, from a collaborator in Madagascar, and they are learning mosquito biology by making pipe cleaner mosquitoes, and they're buzzing. And then after this session, they get out there with their parents and any access of phones they have, and they record. And we demonstrated with school communities, we could do a better job of mapping mosquitoes in village communities as compared to anything that could be done with the traps. And of course, the traps require researchers to engage and come along. On the molecular side, there is another side of this story, which is a technology that we just released, is how do I not just know whether there is what it's carrying? And with this, we have recently released a kind of what we call a mosquito chips or vector chips. So I'll just play this video. If you look at these mosquitoes biting, you will notice that they are lit. This is a video taken in the lab. We have labeled these mosquitoes with a type of a dye. And then when they bite right there, I don't know if you can see my mouse here, you just see the single drop of saliva. This drop of saliva has the answers in terms of thinking about what pathogens that they're carrying, what is the viral load. And ironically, these very simple questions have never even been measured. Until we did this work, we did not know how many particles of a virus are actually injected in a person or a parasite when a mosquito bites. So we built this as a technology in terms of a little piece of rubber card that you place outside your home, you leave for a week, and then you put it in a Ziploc and you ship it. And we can identify not only if in the community there is live transmission happening in the mosquitoes, say for dengue. We did this work for Zika, but the same thing applies for dengue, malaria. But we can also identify which specific vectors, because there is enough DNA in a single bite to identify not just the virus, but the mosquito itself. We can identify what are the key vector species that are causing the transmission. We've also been able to literally use this tool to count viruses. And at least for myroviruses, the answer is extremely heterogeneous, all the way from 1 virus to 35 viruses in a single bite. Now, these are individual copies of viruses. How am I doing on time? I see it's 9:50. And
I was about to find a time to interrupt you. I'm not sure if you have more you want to say on this topic, or if you want to address some questions.
Yeah, I think I am, in some technical terms, I am halfway through,
Okay.
but I don't have to tell you guys. I would much rather have a conversation. Maybe
Sure.
what I'll do is, let me just say 2 words about Foldscope, and then let's turn this into a conversation.
Great.
So there is a large class of technologies that we've been developing. One on the molecular diagnostics front is called SnapDX. Many of you can read about it. It's about electricity-free molecular diagnostics. The punchline is, if you know how to make a cup of tea, and you can make a cup of tea, you can run a molecular assay. Again, going back, diagnostics under a tree, this is an object that does inactivation, RNA extraction, and amplification, but without using any electricity. There is a class of tools we've also been working with in community focused on malaria, which is an imaging-based tool, primarily because malaria diagnostics has huge challenges and it's not sustainable currently. This is work in tribal regions in India, and currently now we're ramping this up to scale in the Northeast. The tool is called Octopi, and one of the power of this tool is to really bring automated imaging to the field and all the advances that is seeing in the context of medicine, but really apply that to communities, and especially in the context of cancer. There is a large number of people that have reached out in thinking a lot about how do we really change our perspectives of imaging-based technologies. And then maybe another one that I'll just mention in this context is the environmental side of the story. We've also been quite a lot about how do we take the same framework that we are applying to diseases, but to apply that to the ocean. I think the context of microplastics, the perspective of losing the health of our oceans will have an incredible impact on communities, and especially fishing communities around the globe that primarily survive. That led to an initiative we call Planktoscope, where we have been building tools for citizen sailors that just love the ocean and go out in a small boat and spend literally sometimes years, empower their boats with very simple tools and use that to measure, rather than these expeditions that cost literally $50,000 per day. These are individual. There are 15,000 or so boats on our oceans at any given time. And that has led us to work with fisheries along Angelica in trying to engage sustainable fishing communities and practices, but by a very measurement-based approach. So, this is a microscope that essentially is a flow-through microscope. Objects and water passes through it, and it does a high-speed imaging, and then it analyzes every one of them objects to make pictures like these, quantifies them, classifies them. And the reason we are now starting to apply this to helminth eggs and to many of these other, worm-oriented diseases, and primarily, again, very much like in an open framework. Lots of people have been building these sets of tools, teaching them and teaching us along the way in terms of what the new kinds of applications might arise. And then maybe in the very end, I'll just say one word about Foldscope. I'm or have at least heard about Foldscope, but if not, it's a paper origami microscope. Many people don't know the science behind it. So on the right, I'm sharing the equation that actually led to the discovery of or invention of Foldscope, is our deep understanding of how we can do high resolution imaging with very simple optics. This is the type of data that comes out of Foldscope user anywhere around the world. You can use it, you can observe it directly with your eye. It couples to cell phones. It also acts as a projector. But the key aspect of this is really around the community. Often enough, when we were building and designing this as a tool, the focus was on the tool, but very quickly it shifted. And what we ended up creating, I still remember in the lab, I made a decision when we published a paper. It came out in PLOS One, and I woke up the next. The academics, we often think about, what an accomplishment. Of course, we should all be proud and happy. And then something dawned on me the next day, which is nothing in the world had changed. This object existed, but literally nothing had changed. And that was a very depressing feeling. And I literally wrote on our lab website that we will provide 50,000 Foldscopes to anybody in the world who asks for it. I had no idea how I'm going to make it. I had no money for it, logistics. But it was this notion that unless we can prove to ourselves and build a community, and that was the single most important decision that we made around this project, because what that did is seeded. We got around 75,000 emails. We processed them using all kinds of tools from 138 countries. And that seeded a distributed, diverse community of people who were passionate about bringing science to their communities, had a very clear wanted to do with these tools, and our role was to empower them. So we took the back seat, the community took the front seat. And at this point, after almost 7 years of work, we have deployed 1.6 million Foldscopes. It's the world's largest microscopy community in the world. And what is so empowering is just the fact that the kinds of things that people do, they're all documented. If you go to this for cosmos.foldscope.com, it involves all the way from individuals around the world discovering new species. It involves methods where you can detect fake drugs. There are many tribal regions and many rural parts of India. We work with the Indian government. That led to these large-scale workshops with hundreds of villages across covered, really trying to think about what does science education even mean? What does it mean for farmers? And it's been really fascinating to think a little bit about what the community has been able to do. There's roughly around 400 or so papers published. We've just published one, but the community has really taken that on and really trying to understand what is the role of a technology in their context. And, I think there are thousands of pictures that I can share, but I just want to give you a sense of what it means for empowering communities. There are conservation biologists that use these tools. There are folks that are in the Arctic, in the Amazon, on the Himalayas, trying to explore and map the biodiversity. There is the context of thinking about mosquito biology. There are fishing communities. There are communities in conflict. This is a picture from Iraq. I'm very proud of the work Mohammed has done there. This was literally 6 months after the war had technically ended, and thinking a little bit about 7-8 years of these kids' lives who have never had the chance to go to school. I'm going to end on this picture. This picture is very meaningful to me because this picture has one of the full scope super users. This individual that you can see in the background is Mo Pandirajan. And at this point, 5 years of work, he individually has trained around 95,000 students across the country. And, I met Mo via an email. In that 50,000 email call I had made, there was an email in Tamil. I don't read Tamil. I had no idea what it said. And just by curiosity, I transcribed it. And it just said 2 sentences. It said, I run a 12 children school. I would love to use a full scope. That's all. And because our policy was anybody who would write, we would ship. And we shipped a whole bunch of full to him. And then 5 years later, he's become a deep friend of mine. He's traveled the country literally every single day, engaging people on the grassroots and training them and bringing them into the context of the microcosmos, training many folks who are, thinking about and aspiring to be medical health workers, community health workers. And one of the aspects that when I think about in this is the purpose of community building in that sense, to then discover and find people like Mo that truly are dedicated on the ground to their communities and are so hungry and eager to find the kinds of tools that can empower their communities. And then my job becomes much simpler. My job then primarily becomes to empower people like Mo. But I would have never discovered Mo until I had just read that email. And this is a hard challenge to think about, that resources are important, but how you deploy these resources are incredibly important. In the hands of the right kind of people, even a tiny amount of resource can really move mountains. And, as long as we can think about the focus is associated with the community, it makes a huge difference in what we can actually do. So on that, I will end. I'm going to unshare my screen because it would be lovely to see you all. I have some time at hand and I can take some questions.
Okay.
Thanks, Manu. That was very exciting. And I actually have a number of questions. So it's wonderful to hear that you can stay a little longer.
Yes.
Because I think people really want to know more about your work and your philosophy. So let me just get started. So the first question is, I find this Operation Moonwatch example so interesting. It's incredible that this effort became a large scale. I imagine that it was very difficult to inspire and captivate so many folks to contribute to an effort like this. It seems that storytelling is needed to inspire people to join and become interested. Can you speak to the importance of storytelling in citizen science?
Yeah, no, I think it's a fabulous question. And sometimes the way that I think about this is giving people voices to tell their own stories. So I have my own life experiences and I have a story to tell, but that is only one of literally millions and billions of stories that are walking around. And for us, many of these scientific tools enable individuals to tell their own stories. And so if you go to Microcosmos, you will find technical content, but you will also find a story of a 8-year-old kid that put a foldscope inside in their freezer because they wanted to see ice cream. And you can't image ice cream outside. And it was a brilliant idea. And now they have a minus 20C microscope. And so, these sets of the kinds of stories and the breadth of what people do. So I think for us, it has been about making sure that the platforms that we build provide voice to people. This is a very simple reason why on Foldscope's website, if you go to microcosmos.foldscope.com, top story is always the story that was just submitted. There's no good story or bad story, because we realized very early on that people are coming from very different starting points. It's not about the most spectacular image or the most spectacular observation or the most deep question. It's about a question. Are you asking questions? And then in the last 7 years, we've been able to watch many of these individuals all the way going from very difficult situations in life, science, and actually being empowered and then being leaders in their communities, because we now have a hindsight to look through that. I think open-ended tools of curiosity are incredibly important, even when we are trying to solve some of the most challenging problems where you feel the most directed intervention might be valuable. We have to do both. We have to be solving problems urgently, but we have to be making sure communities that we are trying to build and build solutions for are actually empowered. They feel in the kind of a seat where we don't see this massive gap that currently exists. How many of us have just, if you go out on a street and ask any random person of how many of them have seen the microscopic world? And the answer is very, very small, while our fundamental principles of medicine depend on it. And because this framework is broken, it's very difficult for us in a pandemic to then implement this is a science-driven policy. There's no science is not a stick. And it's been used as a stick in the past, and it just doesn't make any sense to me sometimes. Science is it's a community, it's a way of thinking. And unless we share it in a very honest, deep way of engaging and embracing and bringing people in how we got started science. So I think that community and storytelling side is incredibly valuable. I think for any kind of project that you are thinking about, the flavors of it change because you have certain goals in mind. But in the end, it's also, I think what I have found for most of our work is when we think of a problem and we bring a technical capability on the line, we revisit the problem again. And that's also a part of the science. That capability, people will run with that idea in many other ways, which may or may not have been why you invented a technology to begin with. And how do you support that?
Great, thank you. So related to the former question, how do you break down some of the barriers of professionalism and the hurdles that funding agencies place to building meaningful and equitable partnerships with on-the-ground workers? Similar question about building a bigger base for open science, how to break down these silos that academia builds up and make research more accessible to everyone.
Yeah, I think this is a question I ask every day. Just like all of you, I have to fund students, I have to fund partners, we have to figure out ways to support much of that work. And it's very difficult. I can tell you, if this is any relief to any of you, I wrote a grant on Foldscope, sent it to every single agency. And so I didn't hear back from most of them. And from some of them that I heard back, the answer was almost like, is this a joke? And it was very disheartening. Here I am, a professor at a university trying to make paper microscopes, and people didn't really understand what we were trying to do. We were trying to invent a pencil, the importance of a pencil. And, sometimes you have to go back. And what I did is I actually, on one of my grants, I stapled a Foldscope. And I don't know if that was legal or not. I had to have the grant, the people who are writing these grants understand viscerally what it means to see the microscopic world. And I literally had a message in that foldscope, which was, unless they had used the foldscope, they wouldn't be able to read. It was printed in a microprint inside the microscope. And, again, I'm not saying it was out of frustration that I felt, but then I put myself in their shoes and I just felt, here is an idea. How do they know what I'm thinking about? What does it mean? How do I explain to them what empowerment truly means? And, we suddenly, the person actually realized, and there is this often enough when I think about making scientific tools and sharing away, there is this sense that often enough I can tell whether somebody's foldscope is working is while they're observing, they are so immersed, they're actually smiling, but they don't know it because they are immersed under the microscope and their eyes are covered. But it's a fascinating facet in thinking about how do we change perception. These perceptions have to also do with what does it mean to make impact? Why are we all here to begin with? I think we will change any of that in a day. We have to just be supportive of each other, think about what open science brings to the table, have enough number of examples on a sustainable side of the story to make sure that these types of operations can actually be sustained as well. And I think many types of agencies will come along. It's the long road in some way. We cannot apply the same principles that apply for other fields directly to when the goal really is to empower others. I think this has been one of the challenges that I can understand that different fields of science require different level and kind of support, different structures, but we should always also be thinking about times change and how can we be plastic in the way we do science. There are no one answers per se, and I think the irony is that all of us have our own roles to play, and how do we then build the kind of again, our own internal community as well, while everybody is heard. I think this is a huge issue that has happened over the last many decades of global health funding, where it has gone primarily to only a pocketful of institutions. And this is the harsh reality of the world. So, these are challenges that many of us have to take on, just like the hard problems that we work on. The systemic challenges are as important. And I think, I feel a sense of hope. There is I do see a sense of hope, but there is there's a long road. I think, it's not nothing is going to change short term in the systems that really are built around. And I think COVID was a great example for that. I think I feel a sense of failure in some sense on the COVID context of just some of the most important things have not been the highest focus. And because of that, it's sort of, there is this perspective that the problems might be much deeper.
Thanks. So how do you define or measure impact across your projects? Is there a common end goal or some sort of success criteria when you do deploy them or these tools?
Yeah, I think just because of my training, I am a tool maker many a times. And so I work with a lot of implementation scientists and I let them decide what they should do. So that's why the 400 papers that are written on Foldscope and its impact and its applications are not written by me. Just these are individuals that took on those sets of ideas. They looked at our programs and then they evaluated them. But from I think, systemic perspective, if you're thinking about scale every step of the way, impact will come. Mm-hmm. And it's perfectly okay for your first try to not one of these common conceptions that we have, that we will invent something and then suddenly millions of people will be using it. That's not how it works. Every project that I think about, I have a very simple rubric of orders of magnitude of power of 10. I don't know how many of you have seen the Power of 10 movie. It was made by these architects in Chicago in the 1950s. And every frame of that movie is a 10x zoom out. And it's a very simple, but powers of 10 kind of, I apply that in my work is I first need to solve the problem in one place. And then I'll just say, okay, we need to build 10 of these, share these with a broader group of people and see what they say. If they agree, then we're going to build 100 of them and we're going to build 1,000 of them. And every step of the way, the tool changes completely. The goals change and what we are trying to do change. But then in the end, it's very clear. If you are trying to, and especially technologies applied to global health, it has to be that it's important to be thinking about at what scale will it matter.
Mm-hmm.
So we have tons of technologies that are very well documented that are sitting in journal papers. And it's because the scaling approach was not applied to them early on, they find it very hard to really get to the communities. So it's important to be thinking about impact, but it's also sometimes decouple yourself. And I often take a lot of joy in my work. And I think about the playfulness and what we are trying to do. And so sometimes, you should never feel there is a sense of burden sometimes working in big problems that just takes us down, because unless you can crack it at that moment. So I think I have my own coping mechanism. Working, don't bring me down so much, because then I know that it's a step for the next bit. But also I am much more focused on that short-term goal sometimes. And then you can step back and say, okay, what was the point? What did we actually do? And I think those moments of reflection are very important, but it's also important to decouple them so that you're not just worried all the time, which happens sometimes because these are difficult problems.
Great. I'm gonna number of these questions you've already addressed in some of your responses. So I'm gonna go to the final question here, which is, how do you go about designing health technology in terms of working against, within, or around an exclusive health industry that seems untouchable by political regulation?
Yeah, I think that's a difficult question. One way of thinking about, I very strongly believe that commercialization of technologies is incredibly important to bring technologies to society. So I just want to state that open doesn't mean anti-commercial. It's about what is the vision and health. If the primary vision of delivering health to people is profit, then that's mistaken. But if the primary vision of a health entity is focused around empowering the largest number of people or providing quality services to the largest group of people, and to do that in a sustainable manner, you have to figure out many of these. You have to work with partners, and actually many of those partners might be industrial, might be conventional entities who know and understand these markets. So it's about bringing people in your camp rather than working against somebody. And sometimes, why has malaria been an open problem until today? It's very difficult to make a commercial case for eradicating malaria. And then we have to ask ourselves, why should we always be thinking about that our sets of things that will scale only will be the ones that have a once you've thought about this deeply, and then you ask that, the sets of technologies can empower. So, this is why we chose imaging as a really important role to play, because having that one imaging station in a clinic suddenly empowers hundreds of other things that are built on top of it. While our first core that we started was malaria, but it completely transforms because it suddenly brings a notion of machine learning to the table in many of communities. So I think there is a long road around many of these issues. Politics, global health is politics in many ways, and we learned that obviously in the context of COVID as well. But you also have to realize that ideas are very powerful. So, companies and other sets of things and folks that have resources, it's our job to convince. And I think the order of magnitude of 10 is a great way for just personally when I'm thinking about if I can't get the order of magnitude 10 working successfully, then maybe I need to do first more before I am trying to get resources to really scale it at a very large scale. So I think much of the work that we do, we try to scale slowly. I mean, it's still order of magnitude of 10 is a very large number when the numbers get large. But at the same time, it's important to see whether if you have the right pitch in place. And I think more and more so, my hope really is that investors in health in many LMIC countries see that. I look at the market in India. The medical device market in India is incredibly rich and dynamic and exciting. And many investors are starting to see that unless they can scale, if their product polos of India, it's just not enough numbers. So they see that point that they need to step out of that. And many investors are starting to realize that. So I think it really is about, there are people who are there to support. It's just a question of eventually have you found the right kind of people? And sometimes those people might be in the community that's most impacted, because, many times the place where the idea comes from might not be exactly the right place to actually implement it. So that's, I think being flexible about these decisions is useful, but these are all very hard questions. They're all context dependent.
Yeah.
But I just want to state this very publicly. I'm not against commercialization. Frankly, it is one of the very important vehicles for us to deliver products to people.
So I guess I wanted to just say something about your talk and your reflections. It seems like trust is at the core, right? Because there are many instances where you might have a wonderful technology, but just because you have it, that doesn't mean they'll come. And through this synergy between the technological world and potentially even commercialization and this open science community, it seems like trust is implicit, so that in a way you're meeting your bigger vision by looking at different aspects of how people behave and what incentives they have to do something or believe that something works. I mean, we know polio is a great example. It can save lives, but if you don't believe it, So I think that's really be very powerful, seeing those two worlds come together. And also the sort of global north to global south idea also gets dismantled if these people have the power. Everyone has the power to go beyond, what is handed to them. So I really love this. And this was a lot of fun. And thank you so much for taking the extra time to talk to us. I know we have a lot to contemplate. And I'm definitely going to be talking to my lab about this for sure. I think we'll be talking for days, Manu, but that is
Thank you so much for having me. I deeply enjoy these interactions, and you can reach out to me. My email is publicly accessible. I'm slow on email, as Antonia knows, but I am reading them, and it would be phenomenal to do much more between the East and the West Coast as well. I think, I haven't had the chance to come out at Duke at some point of time. I think it's remarkable. The way I know about many of the programs that you guys run is we get the students. So, but on the other hand, it would be really fun to do a much more, I think amongst our community itself, there is so much to learn and build on each other's work. So I'm very excited. I'm assuming this as an introduction, essentially.
Yeah, and when we get past or maybe get settled with COVID, physical interactions become the norm.
Yes.
But, thank you so much, Manu, and thanks everyone for joining. And hope you all have a good weekend.
Thank you, everybody. Just wanted to close out by thanking our speaker and to invite you to our next event, which will be on February 25th with Krista Donaldson, who is the CEO of Equalize Health. I will drop that RSVP in the chat, but it's also on our website. So thank you very much, and we will see you next time. I will stop the recording now.
Thanks, everyone.